All right, which of the following treatment options is the most appropriate for this patient? 60-year-old man is diagnosed. Oh, wait. Active surveillance chemo, external beam radiation, prostatectomy, androgen deprivation therapy. So he has a localized prostatic adenocarcinoma with a Gleason score of 6. His serum PSA is 8. No other significant medical history, which is the following most appropriate. So most appropriate therapy for a advanced prostate adenocarcinoma. Or yeah, prostatic adenocarcinoma. I don't really know what you're supposed to do for prostatic adenocarcinomas. I know they can metastasize to the bone. Uh, and it doesn't present late, or it always presents super late. Um, oh no, I'll go with radiation.
Okay, this is kind of interesting. I mean, I don't know the guidelines of prostate cancer, right? This, I mean, most of these questions that are on kind of this step, think this is higher level questioning and probably a little bit too difficult for step two. Um, but apparently a Gleason score of 6 is considered low risk, right? Low risk prostate cancer, active surveillance is preferred management strategy. This involves closely monitoring the patient's PSA levels, performing digital rectal exam, conducting pure prostate biopsies to assess for disease progression. If the cancer progresses and the disease changes, treatment like surgical or radiation can be considered. So talking about radiation, or surgery, what kind of radiation do you want to give to people with prostate cancer that they usually mention? That's kind of interesting.
I'm not sure what kind of radiation, like
Yeah.
neoadjuvant,
So
right?
I'm not talking about when that's talking about I guess when do you give the radiation? I'm talking about the mode of radiation. So they call it brachytherapy. Have you heard of that before?
No.
Okay, let's see. I don't know how to brachytherapy radiation. Is that how you spell it? I don't know. Let's see. Brachytherapy radiation. Brachytherapy is a form of radiation where radioactive sources are placed in or near the tumor. This allows high dose radiation to deliver directly to tumor, reducing exposure to surrounding healthy tissue. So, that's the kind of radiation they usually use for prostate, so that it's usually either a metal rod or something like that that you can give way more radiation locally. So just so you know that that's kind of in your mind, it's called brachytherapy. So, but yeah, so why do you think low levels of like low how do I say this, low risk prostate cancer, why can you observe, I guess?
I mean, it's because most people die from something else, right? Before
Exactly, right.
prostate
Exactly.
cancer.
Yep, exactly. Prostate cancer, it can metastasize, like you said, just like any other cancer, which is why it's considered malignant. But one of the things with prostate cancer is that it's, relatively slow growing. And so that's probably why they came up with some guidelines of when do you have to be a little bit more aggressive, radiation, surgery, things like that. So, but once again, these questions are a little bit probably one step further than you need to know for step two. But, good to kind of go to the deep end sometimes. So